McGuire is a very long-term friend, and he's one of the icons in our field, and it's so cool that you're here. He's former chairman of orthopedic surgery and chief of spine at the University of Mississippi in Jackson, Mississippi. He has held leadership positions in literally every organization, but most importantly, near dear to my heart, he was a spine surgeon, the president of the AO Foundation. So the Holy Grail, the inner sanctum of the Holy Grail at the very top, that was him. And he is a great guy. He's always loved life and had big picture perspectives, and it's been a tremendous influence on me. So it's with great, deep personal gratitude that we welcome you here. Bob.
So what we'll do is, let's see if I can make this thing work here. We always really want to be on a team, and so I tried to make this thing good for everybody in Washington. We got the pros covered, we've got the colleges covered. But if you notice here, this is where, and I was talking with David, this was kind of where I went to school, and then I wound up with the Ole Miss folks. So
that's you on
it's
that
been
diagram.
great.
That's you, right? That's you on that diagram. That's you.
It's starting to look a little bit like me. I just need a red hat, don't I? So, the team approach is extremely important to all of us. I mean, we always want to do that, but one of the issues that we have is the younger surgeons, how do we get them involved? How do we make sure that we keep this organization, this AO organization that's been around for 60-something years, how do we keep it viable? And so we have to train, just like we train, surgeons in residency programs. We need to have a program that's set up to allow that to happen for our younger folks. And so we know the principles. We're not even going to go over this. We'll kind of speed things up a little bit. This has been kind of a great organization. 60 years ago, the surgeons that came up with this idea were considered heretics. You're taking a closed fracture, you're opening it, and you're sticking metal in it. That's heresy. Well, it turned out it wasn't heresy, and it changed the way that we've treated long bone injuries, and of course the spine's nothing but a long bone. So the principles are always the same, so it really doesn't matter. The important thing is that there should be a way for you to maintain involvement in this organization, because we change. If you look at the array of people that are here, you've got some folks that are in a fellowship, you've got some folks that are almost 50 years out of practice, and so there's a lot of variations in what people need, and you have to be willing to be able to maintain relevance on that. We've gone from the carousel slides to the digitalization, and that's been a great boom. One of the best things that could have ever happened was COVID. COVID really pushed us into that digital format, because at that point we were face-to-face, everything was coming, and all of a sudden now we're not face-to-face anymore. So you have to be able to get that information out. And so the digitalization and the way that we distribute education formats changed considerably during that time frame. So we've tried to maintain that from the AO standpoint of being able to manage courses not only face-to-face, but also being able to have courses that are online, webinars, anything that you need to be able to go 24/7. You should be able to get access to that particular type of information. Not only do we have it for our students and our membership, but our faculty. And the faculty has the modules that allows you to entertain yourself by basically becoming a better teacher. And so those modules are there for you to gain access to and really improve yourself. Even you may be 30 or 40 years out of practice, but you still got the ability to access that particular information and improve your own teaching. Where we really want to make a difference is the younger members. We didn't have a way to really be able to engage the young surgeons. And so that was one of the things that I did while I was the president of the foundation. I said, let's make something that levels the playing field. And so we came up with the AO Access. AO Access is a mentorship program that anybody can get involved in. And what that does is we try to pair up a mentee with a mentor. And as a mentor, you actually go through a educational process on how to become a good mentor. I mean, we think we're probably pretty good, but you really learn something from these modules that have been created. And so it really creates a formal program that not only you're able to access, but we're also able to gain data to really see how this is working. And so that's one of the neat things. We've always talked about mentorships and mentors and mentees, but how do you really evaluate that? And that's one of the things that we've come up with the Access program to allow that to happen. So our 4 core values of the spine are the encounter, the transformation, the community, and the participation. And so the encounter is exactly what we're doing right now. I mean, we're engaging with one another. We've got a group of people that have really good conversations. And if you noticed, we disagreed on some of those ways of treating those patients. I didn't see anybody fisticuffing up here. Everybody seems to be pretty cordial. And that's one of the things that I think is extremely important, is that we realize there's more than one way to treat things. And so you learn from one another. A lot of times you learn from your mistakes more than you learn from your successes. But to be able to have those type of engaging conversations is extremely important. And that's what really started the AO. You had 13 guys that got together and said, look, let's figure out how to really document what we're doing and see if it really does change on the way that things are done. And that's exactly what happened. And if you noticed, the whole concept of a bit, the Gemeinschaft für Osteosynthesfragen. How did I do? Did my southern come through?
I have to shake my head after all those years. Bob.
Have not been able to. The southern accent doesn't mess it up. But if you look at this, it's a privileged level of people getting together, having conversations without a hierarchy involved in a concept of friendship. And that is exactly what we're continuing to do here. So I really like what these guys are doing, okay? So now all of a sudden you've kind of transformed yourself from engaging in an individual discussion to a large group. And our community is extremely diverse. We've got neurosurgeons, we've got orthopedic surgeons, we've got research guys, we've got ORPs, we've got the nursing group. So it really engages a lot of different people that are there. So we're able to take our knowledge forums, distribute the information around. We've also developed significant research projects that have changed the way that we treat patients. Probably the myelopathy study was, I know when I was training, a lot of these folks just kind of got neglected, or they would wait so long before you treat them. And this particular study changed the fact that you operate on them quicker. If you operate on them faster, then they're going to be able to get better. And that's what I loved at the posterior cervical, where we got really aggressive on that case that we talked about with that. So that's the kind of information that has come from our research on this. Same things as geriatric odontoid fractures. The beauty of this is 24/7, you can access the surgery reference, and it's got anything that you want, any bone that you want. All you have to do is go to this, and it's a web-based service, pretty easy to get involved with. Membership, how many people are members of AO? I'm preaching to the choir, it looks like, so that's good. But the beauty of this is it's really kind of a club community. I mean, it's really a team, because when we get together, it's almost, even though we may not have seen one another for 4 or 5 years, you re-engage with that particular friendship. in that discussion that's there. So the access, I think, is really what we want to talk a little bit about, because it gives you a career path academically from a faculty standpoint and also a leadership standpoint. And so we realized that as I was going through and Jens is going through, there were certain areas, little box that you had to tick to be able to kind of move into that. And I never fully intended to get to the level that I did. I just wanted to be a good spine surgeon and be a good educator. But there were some opportunities that opened up that allowed me to move into that administrative role, which was really kind of nice. And it was this access aspect of things that I saw that we really needed to make sure that we engaged our people. And so this is one of those things that's a stepwise. So you've got the access, you've got the modules that you can get into. How many people have done the unconscious bias modules? Any type of activities with that? It's really very interesting when you look at that. You'll find out this is a lot of self-awareness. And you realize, you think, okay, I'm not a biased individual. You take these modules and all of a sudden you realize, well, yeah, I think I am. And that's this unconscious aspect of things. I mean, when I did it, I realized I enjoy being around younger folks rather than older folks. That's one of my biases. I really prefer to be around young people. And so that made no sense, but those are the kind of things that you pick up with. So the self-awareness that we're looking at, and it's really the non-clinical. We all know how to operate. We're taught that in our residencies and our fellowships, but it's getting along with people is what we really have to pay attention to. In an operating room, in a clinic, our nursing personnel, we engage constantly with that. And it's the non-clinical, the areas and the non-clinical competencies that we really kind of harp on as far as with the access. And it's interesting, we've looked at, I guess now we've had 4 sections of mentor-mentees. And this is the one thing that they've always come back when we gathered the data. This means more to them than learning how to operate. We know how to be a coach, but the how to behave in an operating room, how to behave in a clinic, are the things that and with your patients. So the other thing is get engaged with the participation. We're going back to Brazil in this next year. You've got research that's out there. Submit an abstract. Submit an abstract to these congresses. Get yourself involved with this, and the beauty of this, and I think I can figure out how to make this thing work. I love this from Sharma, Dr. Sharma from India. He says, if you really want to know anything about spine, go to the Congress. He said, if you're a young surgeon, this is where you want to go. And as an old surgeon, it's always kind of good because there are new techniques that are coming up that that really are helpful there too. So, but it all leads back, all these things that we're talking about, lead back to the mission. And the mission is basically to put that patient in the center. And regardless of what we do in this honeycomb, it always benefits the patient. And so that's where our priority is in this situation. So if this was back when Jens and I were young guys, we've been around a long time, and this community has continued to grow. So it really, I think, is important if you engage yourself early on. You've got lifelong fellowships, lifelong friendships, and your patients will benefit more from the interaction that you have with these kind of discussions. So I thank you very much for having me, Jens. It's been fun so far. I'm looking forward to tomorrow.
So in recognition of coming all the way out here to the rainy Pacific Northwest and almost enduring a cyclone, a bomb cyclone. We wanted to just give you a small little representation to add to your things, but thank you for all you've done for us and AO. I hope you inspire more and we always love your leadership and thoughts and friendship.
Great, brother. Thanks.
Thank you. All right. Onwards and upwards. Any final thoughts? Rod, co-chair, take the microphone.
I think, Bob, we sort of lived through the pandemic, and I do believe that the digital component is a big deal. And as much as I like going to meetings, I think the societies, and this is why I like the AO and platforms like Seattle Science Foundation, is it kind of breaks down a lot of barriers. I think we kind of created our own barriers. Like, if you look at neurosurgery, there's 2 societies. I mean, we don't need 2, we just need 1. Same with the spine. There's so many meetings, And so I think your points are excellent, and I think using technology and education to like break down these barriers I think it's fundamental. I mean, look at tonight. These are great cases we talked about. And like we talked about, I mean, they can all be managed differently, so.
And the fact that we've got the ability to do Zoom meetings.
Yeah.
I mean, you can get a group together, and that's one of the things that with our access program, there will be a group of 5 or 6 people, and they'll share cases just on a Zoom call.
Yeah.
And so we're able to do that with the technology, but that triggered, during the pandemic, we were how are we going to manage all this?
Yeah.
So we got to figure this out, and that I can remember when we had our first board meeting. None of us could travel.
Yeah.
Managing a $1.6 billion organization.
Wow.
And how do you talk to them?
Right.
And so we'd never done anything like that before. And then all of a sudden, you're right. Then we started digitalizing all of our courses, all of our different slide presentations. Everything was there, and people could access it. And then my AO really became, which is the social media that we have to be able to access all of this. And you get a group, you throw a case up. You've got a question, you throw your case up, and you'll get answers.
Yeah.
Just like you get multiple answers, and then you have to choose which one you're going to do. But they're all right. But you're exactly right.
Yeah.
And that's what has kind of moved us forward. But I think engaging the younger surgeons is what we were kind of missing. I can remember, you go to a course and it was just a bunch of old gray-haired guys like myself.
Yeah.
And that's the thing that we're really trying to push through now, is engaging and identifying the younger surgeons that are going to be the leaders for tomorrow.
Excellent. Thanks for coming out.
Well, we thank you.
Yeah.
All right. Final words of wisdom? Wyatt, Texas. Why did you get involved in academics? You're in a very precious city in Houston, very, very competitive environment indeed. You got to kind of function all the time. What drives you to do academics at this point in time?
No, it's what makes me excited to get up to go to work in the morning. There's a place and there's a time for private practice spine surgery, and there's no shame in that whatsoever. But really and truly, what keeps me going and what keeps me, like I said, excited to go to work is training the next generation, and it's something I'm proud to be a part of, and that's why I'm here.
Well, we want to thank you all for coming. Corey, when are we meeting tomorrow?